You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host with today's guest.
Thank you for joining us for another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. It helps people. It saves lives. CVS, URI. Put it in your purse. Leave it in your car. But take it out at night because the weather does damage with it. Dr. Cicchetti is in the house today, and he is with K2 Medical Research, which I just learned a few minutes ago is the up-and-coming company in Rhode Island. So, Doctor, thank you for joining us today.
Thanks for having me, John.
It's a pleasure to have you on. I want my viewers to know what K2 Medical Research is.
So K2 Medical Research is an integrated multi-site clinical trials network. We're primarily based in Florida, but we have sites now in Nashville, and my group just started a site in East Providence. And we are servicing all of Rhode Island, Eastern Connecticut, and Southeastern Massachusetts for clinical trial opportunities for folks in the area.
You know, clinical trials, it's a big word.
Yeah.
You know, in the big scheme of things, you know, we have a couple up in my neck of the woods that do clinical trials. Some good, some didn't make it. Where is K2 in this whole scheme of things?
K2 is a very mature company, and the founders and CEOs have been in this industry for decades, as has my team been in clinical research for decades. And we're very, even though we're a new site, the company is quite seasoned at clinical trials work. And we work with major sponsors throughout the United States and you know, the world really, and making sure that folks are treated in the best manner possible to bring really tomorrow's treatments today to folks.
So what type of research are you doing now?
So our site is mainly focused on brain health and neurosciences, but we do expand into other areas as well. Right now we have trials looking to help people with alcohol use disorders, major depression disorder, Alzheimer's disease. We will soon have trials for Parkinson's disease and stroke as well. We will be running trials looking at vaccines in the future as well. And so there's really our breadth is pretty wide, but our main focus is on brain health and the clinical neurosciences.
So is it basically medication type things that you're working with to see what works and what doesn't work? Vaccines that work and doesn't work? Yeah,
so it's mostly medicines, and you know, any medicine that a physician will prescribe to you has to go through a very rigorous period of study before we can safely bring it to the wider population. And so our job really is to ensure that these medications that are developed are administered in a safe manner and an ethical manner, and they have efficacy. And so at this time frame for some of these medications to get rolled out to the population could be decades, but this clinical trials provides an opportunity for folks to get them sooner than that.
You know, there's been a lot of conversation pertaining to brain health, obviously with dementia and a lot of other things. I mean, I was dealing with it with my dad, you know, the 5 o'clock sundown issue. And it affects a lot of people. I mean, everyone you talk to, it's like, I don't know what happened here, where we have a lot more than when we had it years ago. Or maybe years ago, we didn't know what it was, you know? So how does a company zoom in on a particular disease and try to get the right product, get the right fix to help all these people?
So there's a lot of very smart people across the entire world working on this problem, and it's a growing problem. You know, Alzheimer's disease was first described in the early 1900s by a German neurologist, and it still remains a major problem across the board in terms of not even being diagnosed in the first place. So there's an underdiagnosis problem. There's a significant delay to diagnosis problem, and there's a growing number of folks with Alzheimer's disease and other dementias across the country, and it's really exerting a major burden on the healthcare system writ large. Fortunately, we're at the very beginnings of a total revolution in this space, where we now have therapies that can adjust the trajectory of folks' clinical course, and soon enough, we will have therapies that are even better than the current ones we have now. But it is a major problem, and it requires a lot of hands on deck from pharmaceutical companies that work to develop these medications over decades, from the start of development until bringing it through several different phases of clinical trials and then ultimately to market.
Right.
For a clinical trials company like K2 Medical Research to actually go out and find participants willing to give their time to complete clinical trials, to find if these medications are efficacious or not. And then really, across systems, administrators and healthcare systems, legislatures need to really focus on this effort, because it's a major problem that has significant social and economic impacts for our state in Rhode Island, but across the nation and worldwide.
No, I'm sure it's really affecting the Medicaid budget, because there's a lot of folks that are in nursing homes now because of this dementia issue. What is the youngest, if you know? I mean, I hear people maybe 50, 60, 70. Is there anything lower than that dementia is found in adolescents?
Yeah, well, not necessarily in adolescents, but there are rare genetic syndromes that can promote Alzheimer's disease and other types of dementia at a much earlier age than others. But the typical age of onset for most dementias is in the 60s, 70s, and 80s. And there's lots of different types of dementia. Alzheimer's is by far the most common. But it's not unheard of for folks to get diagnosed in their 50s with early onset Alzheimer's disease. And we're at a stage now across the healthcare system where we need to really focus on identifying people as early as possible, even before symptoms start, so that we can find some sort of therapy that can alter the trajectory of their clinical course to maintain cognitive awareness and functionality in society as long as possible before requiring being set up in a nursing home or other kind of assisted living facilities.
Is there a correlation between substance use and Alzheimer's, alcohol and Alzheimer's?
Well, yes, there is. It's a risk factor. So excess alcohol use in general puts you at risk for lots of different diseases, including cognitive dysfunction, but it also increases your risk of cancer, of heart attacks and strokes, cirrhosis, and gastrointestinal disorders. It just wreaks havoc on your bodies. Alcohol and smoking and other drugs. It will just really decimate people. And so whatever we can do to really control things that we call modifiable risk factors, things that we can actually do something about, right? Anything we can do as clinicians to act on the modifiable risk factors, we really should be doing. Things like genetics, and age, those are non-modifiable risk factors. We can't do anything about that. But we should be really focusing on what we can control. So substance use disorders is a big one. Blood pressure control is a big one. Activity, so exercising regularly, sleeping well, reducing stress, which is hard for everyone to do. I got 3 young kids. It's a stressful time across the board. But it's something that really, as clinicians, we need to really focus on for patients and their families.
We got to go to break, but I want to talk about genetics when we come back.
Okay.
You're watching Recovery TV, and I'm your host, Sean Tassoni. We'll be right back after these messages.
And now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, Sean Tassoni, here with Dr. Dan. And Dr. Dan is with K2 Medical Research here in Rhode Island now. Doctor, thank you for joining us today. It's always a pleasure to have someone with your high integrity coming on the show and talking about substance use and mental health. I want to talk a little bit with genetic testing for Alzheimer's. Is it possible that someone who is in their 50s, early 60s, or maybe even 40s, to have some sort of test to see if you're in line to get Alzheimer's?
So there's lots of really interesting work coming out now about biomarkers for Alzheimer's disease and other related dementias. So for the past decade or so, we've had good brain imaging scans to help diagnose Alzheimer's disease. And then subsequently we had markers in the cerebral spinal fluid, so the fluid that is on the surface of the brain and around the spinal cord. And more recently, there's more interesting work coming out for blood-based biomarkers that can tell you with a high degree of sensitivity and specificity of whether or not you have Alzheimer's disease or not. And there are other genetic risk factors for Alzheimer's disease, like ApoE status, APP protein gene, and there's really a number of different tests that you can obtain to provide a mosaic for that patient, in addition to clinical, most importantly, clinical history and examination, to put together a picture of whether someone has Alzheimer's disease already or is at high risk of Alzheimer's, or interestingly, the field is going in the way of someone has Alzheimer's disease but doesn't have symptoms yet of Alzheimer's disease. So there's still some controversy around that in the field, but that's where the field is going, and really with the main focus of identifying people early on and being able to start medications soon to change the trajectory of the disease.
So one of the big problems that we're having here in Rhode Island right now is alcoholism.
Yeah.
Alcoholism has now surpassed the opioid use because obviously people don't want to go to the street anymore to get their opioids because they don't know what they're getting with the fentanyl and everything else. So alcohol has skyrocketed. Sales have skyrocketed. What is your organization doing for alcoholism?
So it's a major problem, not only in Rhode Island, but across the country. And it causes almost close to 200,000 excess deaths in the United States per year. And Rhode Island actually carries an excess number of such deaths as a state compared to other states on average. We are currently enrolling folks into a clinical trial and have another clinical trial coming soon in the fall looking at GLP-1 drugs, things like Ozempic or Wegovy, to see if that can help reduce the intake of alcohol in folks with moderate to severe alcohol use disorder. There's been lots of interesting work on this front, and we know that these medications work very well for obesity, particularly in diabetes. And anecdotally, what we found was that physicians and patients started saying, hey, this seems to really reduce cravings for alcohol, for tobacco. And there are sub-studies within other larger clinical trials around medications like this that showed a signal that there was benefit for folks who were drinking too much. And so now there's several clinical trials out there looking specifically at folks who are struggling with alcohol addiction and seeing if these can't provide a treatment option for them. So we're currently enrolling a study right now, and we have another study coming this fall as well.
When I talk to the folks that I represent with residential treatment, and they're telling me that they're getting more people with alcoholism, liver issues, kidney issues, heart issues. When I talk to my local liquor stores, and they tell me how much it's increased, even in the college-age kids. I mean, before it was high, but not as high it is now. The amount of beds that are being utilized in Rhode Island compared to opioids has increased tremendously. Now, you say, well, kids are going to drink. Well, yeah, kids are going to drink. That being said, when you have someone who constantly, not on a Saturday night or a Friday night, it's Monday, Tuesday, Wednesday, Thursday, Friday, the whole week, and people have been on this show that are in recovery that were functioning alcoholics that used to drink like there was no tomorrow. I think that when your organization can come up with a clinical trial that, if it doesn't wipe alcoholism out, but cuts it back, there's a tremendous amount of savings to the state on Medicare, people, Medicaid, who constantly use alcohol to, whether it's to drown out their problems, whether it's a social issue. I think that you know better than I, if you can get something that does that to stop the craving, that's a grand slam.
I think so too. I couldn't agree with you more. And there's a major, infrastructure problem, not only across Rhode Island, but across the country, really, in terms of the volume of patients that are suffering and availability for resources. And so whatever we can do to find new treatment options for patients who are struggling with alcoholism and other substance use disorders, that's going to be, that's going to be a huge win, because the current treatment options, while there's a few, they're pretty limited in terms of their effect size, in terms of how they actually help people, in terms of keeping them in remission.
It's a game changer.
It's a game changer, and these medications, work on the brain reward system. So we know they're very good at reducing weight, but they also work on reshaping the brain and how that reward system works around addiction. And so it might be a completely new method of treating folks with not only alcohol use disorder, but other substance use disorders. And so I'm really excited about this treatment option for patients in the future.
Well, you also have to look at the cost.
Yeah,
The cost of healthcare.
Yeah, it's a problem.
The cost of people that are in business, the cost of keeping your employees,
Yeah.
sick days, hangover days, whatever they want to call them now, the production in the workplace. We have a lot of it.
Yeah, the estimated costs are about $250 billion a year in the United States for excess alcohol use.
Right.
It's a major problem.
I mean, I work with the unions all the time with this issue. An average somebody who's just getting into the union, being an apprentice, to when they graduate to be a full-fledged electrician or whatever, it's a significant amount of money that these companies are putting into these employees in order to be productive workers. And if they go half the way, that's money that's thrown out the window because Johnny wants to drink instead of go to work.
Yeah.
So it's a big, big problem.
Yeah, and I think we have to really approach, alcohol use disorders and other substance use disorders as a chronic relapsing brain disorder. That's really, really what it is. And so we need to start thinking about it. It's because he's down on his luck, or he's depressed, and there's a lot of comorbid psychiatric conditions like depression and anxiety that go along with it. But we really need to start thinking about it more from a brain level, an addiction level, and ways we can alter that addiction pathway in the brain.
We got to take another quick break so I can pay the bills. You're watching Recovery TV, and I'm the host, John Tassoni. We'll be right back after these messages.
Now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Dr. Dan is in the house, and he's with K2 Medical Research. Doc, thank you for coming on. Very interesting segment. I've never had someone in research here before, but my viewers would like to know telephone number, website, and where you're located.
Sure. So we're located in East Providence at 1018 Waterman Ave. Our phone number is 401-955-K2K2 or 401-955-5252. And you can find us online at k2med.com/K2 East Providence. We're also on social media, on Facebook and Instagram, and that's where you can find us.
Well, I'm going to do that as soon as we leave the building today. Well, you'll have a new Facebook follower.
Perfect.
I want to thank you and your organization for doing what you do. A lot of people need help, whether it's in Rhode Island or California or wherever. We got to eradicate this issue. We have to. And I say this all the time to folks on TV when they watch me. I hope someday somebody knocks on the door and says, John, we don't need the show anymore. Everyone's good. There's no more overdoses. There's no more alcoholism. We're all good. But you know it and I know it. That's never going to happen. So thank you for what you do.
Thank you, John.
Coming up next is Kodak Live, a fully integrated approach to care. My guest next week is Tommy Joyce and George O'Toole. Please be safe. See you next week.